Exercise can make you healthier or it can wreck your body. And if you're in one of these groups, working out today might actually be the worst things you could do. We're just a few days away from March, and I'll be introducing a new monthly fitness challenge for my YouTube community. But before I do, and since we'll be kicking it up a notch, I thought it would be prudent to do another video about who should not be exercising without getting cleared by their provider, whether that's your physician or nurse practitioner or whatever. But first, hello everyone, my name is Ray, and I'm a hospital-based nurse practitioner who specializes in cardiovascular disease. This channel is all about heart disease prevention as well as other topics on overall health and wellness. So if that sounds good to you, let's get started. So when I started this channel, I did a short, which is no longer than 3 minutes, about who should not be exercising without getting medical clearance. But I thought it would be a good time to readdress this very important topic. Generally speaking, we tell everyone that they should exercise to get healthier, but there are some what we call hard stops when it comes to exercise if you fall under any of these categories. We'll start with the absolute contraindications first and then talk about the relative contraindications. Absolute, the very first one is what we call an acute coronary syndrome, or ACS. This means you just had a heart attack. This might seem obvious, but I can't tell you how many times I've had a patient in the hospital ask me, when can I get back to work, or when can I get back to exercising? And I'm like, really? Sir or ma'am, you just had a heart attack. Take a chill pill. And listen, I get it. We all have to work and support ourselves and our families, and it can be a quite stressful time, but trust me, the last thing you need is to return back to the thing that might have largely contributed to your heart attack in the first place. So after an ACS, we'll order cardiac rehab for you, and you'll be undergoing supervised exercise where we'll monitor your vital signs and ensure you are able to return back to your baseline as quickly and safely as possible. The next absolute contraindication for exercise is what we call an untreated third-degree heart block. This has to do with the electrical circuit of the heart. In cardiology, we like to joke that there's plumbers and electricians. The electricians or electrophysiologists are the ones that manage things like a third-degree heart block. This is the worst heart block that you can have. It can predispose you to bradycardia or slow heart rate, ventricular arrhythmias or arrhythmias coming from the bottom chambers of the heart, the ventricles. It can predispose you to syncope or passing out, or what we call sudden cardiac death. So typically, if you have a third-degree heart block, it's also called a complete heart block, by the way, you'll need to have an electrophysiologist place a permanent pacemaker depending on your circumstances. And then the final absolute contraindication to exercise is acute heart failure. This is also one of those situations where I've had countless patients over the years ask me when they get back to when they can get back to either work or exercise, because they might actually feel pretty good when they're started on the right medications in the hospital. Typically, these patients come in with symptoms of heart failure like shortness of breath, fluid retention, chest pain, etc. And then once we start them on what we call guideline-directed medical therapy, including diuretics to get some fluid off of them, they almost immediately start feeling markedly better. So the natural instinct is to think that that miraculously their heart failure has resolved. And once again, we have to say, not so fast, bucko. You've just been diagnosed with heart failure, and you really have to take things easy and slowly to reintroduce activity, because managing heart failure is definitely an activity balance situation. I remember I had a 93-year-old woman describe her typical Monday to me, and she literally did more in one day than some people do in an entire week that are half her age. So needless to say, we talked about spacing out her activities and, things like that to avoid landing herself back into the hospital with congestive heart failure exacerbation. So actually, there's one more absolute contraindication, and that's something, two more things, sorry. Uncontrolled high blood pressure or hypertension and diabetes. I'll talk about hypertension first. The reason why you shouldn't be exercising if you have uncontrolled hypertension is because you can actually have a heart attack or stroke. When we do a stress test on someone, we'll monitor like their EKG or ECG, heart rate, blood pressure, etc. I personally have seen some people get their blood pressures in the 200s with just walking on a treadmill. So imagine doing anything more rigorous like jogging or running or even strength training. This could be a recipe for disaster, and it can be life-threatening. So before you start exercising, if you have hypertension, make sure that your blood pressures have been controlled. Now, when it comes to uncontrolled diabetes, there are two major concerns with exercise. The first and biggest concern is that diabetes and coronary artery disease go hand in hand, like coffee and mornings do. So, exercising without knowing if you are at high risk for having a heart attack is not wise. So, I'd definitely recommend seeing a cardiologist if you have uncontrolled diabetes before engaging in any exercise. The other concern about exercising with uncontrolled diabetes is even mild activity can precipitate or exacerbate something called diabetic ketoacidosis, or DKA. I won't go into all the physiology about it, but this is typically more common in type 1 diabetics, but it can certainly happen in type 2 diabetics. In the setting of insulin deficiency, exercise increases counter-regulatory hormones like catecholamines, cortisol, glucagon, things like that, which it promotes your liver to produce more glucose, and this just worsens hyperglycemia and ketone production. And so it just becomes a vicious cycle. Trust me, I've taken care of a lot of patients in the ICU with this DKA, or diabetic ketoacidosis, and it can be life-threatening. So, and then the final concern with uncontrolled diabetes and exercise is that it can predispose you to dehydration and heat-related illness, which again can land you in the hospital. So now moving on to relative contraindications. The first one is valvular heart disease. Now, although this falls under the relative, it largely depends on the severity of valvular disease. For example, if someone, if you have something called aortic stenosis and your doctor has told you that it's severe, you might need a new valve or repair of the old one. So if this is the case, definitely consult your cardiologist about exercising, because they'll be the ones to clear you for it. Another relative contraindication is what we call complex ventricular ectopy, or an unstable ventricular rhythm. Again, if you've been diagnosed with this, you'll likely be seeing an electrophysiologist, and he or she will be the one that clears you for exercise. Sometimes these patients need a pacemaker or defibrillator, like our third-degree heart block patients do that we talked about earlier in this video. And then the final relative contraindication is something called a cardiomyopathy. These patients, if you've been diagnosed with a cardiomyopathy, again, I won't go into too much medical jargon, but this means that your heart is structurally or functionally abnormal in the absence of coronary artery disease or hypertension or valvular problems, the problems with the valves of the heart or the pericardium, or a congenital heart disease or something like that, that sufficiently explains what the abnormality is with the heart. So there's 5 main types of cardiomyopathies, and I'd be happy to do another video talking about these. If anyone is interested in a deep dive, comment down below and I'll add that to my list of upcoming topics. And with that, I'll start closing this video. So if you're over the age of 40, keep in mind, the average life expectancy globally in 2023 was 72 for males and 76 for females. So here in the US is a bit higher at 78, but that means if you're over 40, my friend, you are middle-aged. So anyway, I want to thank you for spending your time with me here today. Time is one of our most precious gifts that we can give, and it is finite. So if you've made it this far, I want to thank you for sharing yours with me today. If you have any questions about this or any other video, feel free to leave me a comment. I read and answer them all and look forward to an engaging community. If you found this video to be helpful or informative, please let YouTube know by hitting the like button and subscribe to the channel. Make sure you turn on your notification, your notification bell on, so you'll never miss when I upload a new video. I want to say a big, huge thank you to all the current subscribers. We're up to 448. Y'all are really motivating me to continue to do this work and make content that helps others. Please consider sharing this with the people you love in your life, and I think together we can decrease the burden of heart disease one video at a time. While you're here, I'd love for you to check out some of my other videos, like my video about sleep and how it can affect your heart disease risk. If you're a diabetic, make sure you check out my video called What Big Pharma Doesn't Want You to Know About Diabetes, which is a major risk factor for heart disease, like we talked about earlier. I have a video about something that nearly every woman will experience, perimenopause, and how hormone replacement therapy can impact your heart disease. So make sure you go check that one out too. I hope to see you in the next video. God bless you.